So this is a bit of a different video. I wanted to talk broadly about medical errors, making errors, specifically errors of omission versus errors of commission. And what that means is when you make an error of commission, it means like you are committing an error. So you're giving the wrong dose, you're doing something that's causing harm. Where an error of omission is you're omitting to do an error. So you should do something and you don't. I mean, this is very common practice that there are errors in medicine. All doctors make errors. Most of them are minor. Sometimes you make major errors. It's also conventional wisdom that when you make an error of commission, that's better than an error of omission. And I think back to when I was in medical school and a resident, and I definitely also thought that errors of commission were better than errors of omission. In retrospect, once you start practicing, you see they're basically the same. You want no errors, and they can both be harmful. So that's what I really wanted to talk about. So an example of where you can make commission errors, omission errors, is let's say you have a patient comes in, they have fever, they have chest pain, they have cough. Let's say you don't really know a lot, but you have to make a differential list of what could possibly be going on. Maybe the person has flu, maybe they have COVID, maybe it's just some random respiratory illness that they caught. This could be asthma. This could be, I don't know what else. It could be a heart attack. It could be a pulmonary embolism. And that's a pretty good differential list. And you have to work up all of those things. So let's say somebody doesn't think of all those. Well, that could be an error of omission. You're omitting to think of a diagnosis that is common. Or you go to treat all these things, or you do a workup on all this, you don't do cardiac enzymes, missing the MI, you're omitting an error. Where committing an error would be, okay, you think this is a heart attack, you think this person needs a clot buster, you give it to them and they bleed out, and you didn't actually really look up something. You are committing an error by giving a certain medication. Or you think the person has pneumonia, you don't look up what their allergies are, and you give them a medication that causes anaphylaxis. You are now committing an error. And that's kind of the general overview of errors of omission versus commission. I actually have a short story about an error of omission that I didn't commit, but it was committed to my patient. I had a patient who came in, she was pregnant. She started telling me that she was dizzy and started talking to her more, and then she started saying she had a toothache, and I'm like, okay. I'm like, you probably should go to the dentist. She said, I did, and then I'm like, okay, what did they say? They said I may be getting an infection. I'm like, no, you either have an infection or you don't have an infection. She said, well, they said I had an infection, but I didn't, and they released me. I'm like, that doesn't sound right. So I ended up phoning the dentist and asking the staff what was going on. And they said, oh, she may be getting an infection. I just kept probing, and I'm like, that doesn't make sense. She either has an infection or she doesn't. Anyways, I said to them, okay, it's probably because she's pregnant. So I asked them, if she wasn't pregnant, what would you guys have done? And they said, oh, we would have given her this antibiotic and that antibiotic. And I'm like, so you think she has an infection and you guys didn't treat it? And I definitely got into an argument with I think it was her medical assistant. Anyways, that's an error of omission. Somebody has something, you think they have an infection, and the reason why they didn't want to treat was because they thought she's pregnant. So in pregnancy, there's a lot of drugs that are harmful to the baby. So basically they thought, it's better for us not to treat. We don't want to harm the baby, and then we'll see what happens with the infection. But both things are harmful. One, yes, treating her, you could harm the baby, but not treating her, you could harm her, the infection could spread, and she's pregnant. I ended up phoning an OB that I knew. We discussed the case. She was going to use the same antibiotic that I would have used, and I treated it. There's no right or wrong answer. The patient ended up being fine. It was the right antibiotic, and she got better. But that's an example of how an error of omission can happen. Just another side note, I had a patient who was a lawyer, and she was saying something about some diagnosis, and I had no idea what she was talking about. It was something out of my purview. And I said to her, you know what, I don't know that. And she said, I'm really impressed with you. She said, as a lawyer, I spent 20 years in practice before I was comfortable admitting to people I don't know. And then maybe it was my training, just training in medicine, that sometimes you admit you don't know stuff, and you have to know what your limit is. So anyways, I just thought it was really interesting, and I think that does also help with errors, knowing what your limit is, knowing what you don't know, and then knowing when you need help. I think just knowing who you are as a doctor, knowing what your specialty is, knowing what you should know, and knowing what you don't know. So that's just my little talk on different types of error. Along this same topic, I read a book recently called The Checklist Manifesto. And basically it talks about how in medicine and in the world now, things are super complicated. We don't just have general practitioners, we don't just have surgeons, we have pediatric cardiac surgeons. Things have got so complex. And in this book, it was talking about having a checklist for things, and they were using checklists in the ER and checklists in the OR, and it reduced error considerably. And it was just amazing to see that how having a simple checklist with 7 to 9 things reduced error so much just because things are so complex in medicine now. I think just being comfortable in your practice and your everyday practice, you just learn how to handle things better.